Hello again, I'm François Houÿez from EURORDIS. Welcome to this video to explain the work of the HTX project focusing on patient-reported outcome measures. So we've navigated through the website that explains the work done on the PROMs. We've looked already at some of the scales, the PROMs that you can find on this website. We looked at the EQ5D, the most frequent scale for quality of life, when it is used by a healthcare professional asking you some questions, or directly used by yourself, a kind of self-completed quality of life questionnaire that you can use with devices online. But there are other materials and resources that you can find on the website. And in this video, we will look at some additional information of interest to you. So we've looked at the app, and I would like to show you just one more questionnaire, which was developed specifically for one of the diseases that serves as a case study in the HTX project. It's a rare cancer, the head and neck cancer. And as you can see on this questionnaire, which is a self-completed questionnaire by the patient, it explores the body image, how you feel with your body image. So there is self-image, and with questions such as the first one: I am afraid of being rejected as a result of the changes in my body, appearance, function, sensors. And you can choose between not at all, a little bit, somewhat, quite a bit, very much. And you have other questions, as you can see, on self-image. Apart from self-image, you also have series of questions on social discomfort of having the disease. For example, when you're in public, if you feel embarrassed by the changes in your body, or if you are worried that strangers will stare at you as a result of the changes in your body. And you can read the other questions. So these were specifically developed for head and neck cancer, and they can be adapted to other diseases where self-image or social discomfort are impacted by the disease. A psychological scale that you can also find on this app. Here, different cohesion scale, family cohesion scale, with questions such as family members know each other's close friends, or family members avoid each other at home. You see, really questions on how is the situation in your family. It's quite intrusive, but there are situations where these questionnaires can be useful. So apart from the family cohesion scale, you have different scales with different questions with 8 items or 20 items, depending on how detailed the questionnaire needs to be. And always with some explanation, almost never, or never, once in a while, sometimes, some explanation on what this scale, how to fill in this scale. About emotional bonding, there are other questionnaires and family boundaries that can accompany this kind of tool. If you want to learn more and to understand better all the information, all the resources on this website, there is the PROM guide, which will help you understand what are patient-reported outcome measures, why we need these PROMs and what they are for, when are they used, how to use them in clinical practice or as part of a research. Should you use a local one, a national one, an international one? And how do you get started with PROMs, including with the creation, the development of a PROM when there isn't one for your disease? There is also a checklist to help you decide if you're ready or if your doctors, your healthcare professionals, are ready to use a PROM for a purpose of interest to you. So on page 4 of this document, you can find a complete content list of this guide. So again, what are PROMs, the background, different options that exist, why and what for, how do they work, starting locally, getting started, or the checklist. It's quite a long document, 35 pages, but any academic team you work with might be curious to read and get more familiar with PROMs starting from this guide. Another resource of interest, because there are many other resources that can help you select a patient-reported outcome of interest to you. So this one is in the US. It's called Common Data Element.ninds.nih.gov, and it's the CRF library. And in this CRF library, there is this search engine. You can search for different diseases, amyotrophic lateral sclerosis, cerebral palsy, congenital muscular dystrophy, epilepsy. So quite a long list of conditions which are rare, except a few, Huntington disease, etc. So for example, if we select Friedreich ataxia, subdisease, you also have subtypes of the disease. So domains, there are many different things that can be measured. So assessment and examination, that's more at the clinic. Let's see outcomes and endpoints, which can be used in clinical trials, for example. And when we search, this is the outcome we have. Almost, well, 31 different scales, different patient-reported outcomes that you can use, which were defined for Friedreich ataxia. So you have the different versions. So one of which is called the FARS, Friedreich Ataxia Rating Scale. And when you want to learn more on this Friedreich Ataxia scale, you will have an explanation of the scale in terms of a short description of the instrument, its strengths, its weaknesses, how the scoring needs to be completed, and different scientific references. And here you have different search tools. You can search using CRF search, and CRF is the case report form where you can find different products, different tools. So the FARS, Friedreich Ataxia scale for quality of life, looks like this when it is completed by a healthcare professional. And so the first question is ask the patient to cough as hard as you can 3 times. And the doctor, the healthcare professional, accepts the strongest attempt. And then a score is between 0 to 2, depending if the patient managed to cough or not. Or same to repeat sentences. The president lives in the White House. The traffic is heavy today. So that's a US scale. The sentences might change, the questions might change. So that's why there is an adaptation to other countries, to other populations. Not everybody has to repeat the sentence related to the President of the United States. So this is an easy adaptation. Sometimes the adaptation is more subtle, but ideally, the scale exists in different versions, not only language translated versions, but clearly cultural adaptations. So you have other tests to complete, finger to finger, nose to finger, So really to measure symptoms which relate to Friedreich ataxia, and all of them were selected to document on the symptoms and functions of Friedreich ataxia, the movements that patients cannot easily do, rapid alternating movements of the hands, finger taps, heel along shin slide, etc. So specific to this scale. So on this website, you can find many different scales. Let's look at amyotrophic lateral sclerosis. Again, outcomes and endpoints. And when you search, this is what you will find. So you have the here 68 different tools you could use for Friedreich ataxia. So the well-known 6-minute walk test. So this is not exactly a patient-reported outcome measure. It's a test where the patients walk for 6 minutes and you measure the distance, and you can compare the distance with time. But when you navigate among all the different scales that exist, you can find patient-reported outcome measures like this functional scale. And the importance of these tools is when, for example, you are discussing a research study, or when meeting with your clinicians, you would like to use such a scale to follow up the patients at the clinic, or in a patient registry, ask patients to self-complete the questionnaire at regular intervals to learn more on the evolution of this outcome with time. It's important to have an idea of all tools that already exist for your disease, and discuss which one you think is the most relevant. Ask the most relevant questions for your disease, but also which one is simple to use. Often, if there are many questions, if it takes a long time to respond to the questions, as time passes, and because it's repetitive, you will need to complete it several times. People might tend to not being wanting to continue using it. Or if it's too short, on the contrary, and you remember the questions you were asked some weeks or some months ago, this may influence the response that you will provide today. Or if the interval between two questionnaires is too short, you will remember what you answered, and this may influence what you want to answer today. There are limits and biases using these questionnaires. But with the PROM Select app from HTX and other resources that exist from different academic universities, or here the National Institute of Health in the US, you can find different tools that exist and discuss them with your peers and your doctors. EQ5D is certainly a frequently used scale for quality of life, not too long not too complex to use. But be curious, explore which other tools exist for your disease. And if you can't find one, you can also start from a scale from a similar disease or a disease affecting the same organs than your own disease. Start from an existing scale and see with your clinicians and academics how you can adapt, test, and validate a different one specific to your disease. It takes time, but once it's done, it's extremely useful in clinical practice and for clinical trials to use such patient-reported outcome measures. And I thank you for your attention.